distinguished guests, Dr. Grace Magembe, the Deputy Permanent Secretary at the Ministry of Health, Dr. Felix Bundala, Assistant Director, Newborn, Child and Adolescent Health Services, the Ministry of Health, Dr. John George, HIV and AIDS Specialist at UNICEF, esteemed government officials, distinguished panelists today joining us, Mr. Lema, Ms. Given Sam, representatives from research and academic institutions, as well as health providers, executive officers and directors, as well as representatives from local international organizations, adolescents and young people present with us here today, and all invited guests. Karibuni sana. You're most welcome to this AAPH forum dubbed Adolescent, Mental Health and Nutrition in Tanzania, where we'll look at evidence, policy, and practice in this area. The objectives of this forum shall be to discuss the existing policies and current practices on adolescent mental health and nutrition in Tanzania, where we'll share evidence on adolescent mental health and nutrition and learn lessons from the different ongoing interventions. Really, this is to create a space for discussion among researchers, program implementers, and policy makers to really divide the evidence and advise on the adolescent mental health and nutrition agenda. We hope that this will strengthen our networks in order to improve adolescent mental health and nutrition services across all stakeholders, not just in this country, but globally. So the outcome of this forum is really to bring about a collective understanding of current policies, practices, and the latest evidence and application of best practices for adolescent mental health and nutrition in Tanzania. My name is Amani Tinkasimile. I serve as a Research and Programs Manager at Africa Academy for Public Health, and today I will be your moderator. So without further ado, I'd like to welcome one who will give us an opening note and remarks to welcome us officially to this forum. She will also welcome the keynote speaker thereafter. The Chief Executive Officer at Africa Academy for Public Health, Dr. Mary Mwanyika Sando, has an experience in designing, implementing, and executing of mental health, child health, nutrition programs, and has worked in different institutions, including the UNICEF, as well as the MDH. Really, her experience and efforts are in research, training, capacity building, translation of scientific evidence into policy and practice, as she advocates for respectful maternity care. Dr. Mary Mwanyika Sando is an active member of the Medical Women's Association of Tanzania and is currently the president-elect for the same. She completed a medical training at the University of Dar es Salaam back then and holds a master's in public health in global health and population from the Harvard T.H. Chan School of Public Health. Ladies and gentlemen, please a round of applause for Dr. Mary Mwanyika Sando.
Thank you, Amani, for the kind introduction. Habari za asubuhi. Dr. Grace Magembe, Deputy Permanent Secretary, Ministry of Health. Dr. Felix Bundala, Assistant Director, Newborn Child and Adolescent Health, Ministry of Health. Dr. Fatma Mrisho, I was looking for you. She told us yesterday that she just retired a week ago. Hongera sana, Dr. Mrisho, and thank you for your service to our country. Former Permanent Secretary, Ministry of Health, Zanzibar. Government officials present here, heads from donor agencies. See Dr. George Mgomela there. Heads and colleagues from various implementing partner institutions like our close allies, Dr. David Sando, Management and Development for Health. I believe there's a colleague from MUHAS, hopefully UDOM. Representatives from research and academic institutions, and various heads of various local and international institutions. Colleagues from the business community, adolescent and young people. Can I see the hands of the young people? Everybody's young, right? By your age. Everybody's young. Dr. Irene, nyosha mkono mpaka juu. Excellent. All protocol observed. Good morning, everybody. Before I forget, our very esteemed first female medical doctor in Tanzania, Professor Mwaikambo. Mmesikia hapa nimetajwa an active member of MEWATA. I cannot not say about MEWATA. She's also the founder of the first of the Medical Women Association of Tanzania. Leaders wengine, Dr. Florence Tem, thanks for being here, head of AMREF, Dr. Isa Muya as well, director of programs. I'll go over and over and over, so I won't look at you. Otherwise, all protocol observed. Good morning again, ladies and gentlemen, and welcome to this esteemed gathering this morning. As introduced, my name is Mary Mwanyika Sando, and I serve as the Chief Executive Officer for the Africa Academy for Public Health. I'm deeply honored this morning to welcome you to this forum. The Africa Academy for Public Health is a non-governmental, non-profit research organization. It was established back in 2009. Our focus is on advancing public health priorities, and we do this through collaborative research, training, capacity building, and translating that knowledge that we get or that from our partners into policy and practice. AAPH colleagues, we say at AAPH, everything we do is, guys, mawasikia AAPH colleagues, everything we do is for better public health. Asante sana. Together with the Harvard THS University School of Public Health, back in 2014, AAPH founded the Africa Research Implementation Science and Education Network. This network is a network of collaborating institutions and partners really geared towards advancing capacity for research within this part of the world. And it comprises of 21 member institutions from 9 countries within the sub-Saharan Africa. AAPH is the convener of the ARISE network, and it also serves, the network serves as a platform for education, research, addressing different public health priorities such as, and which is our main focus until now, adolescent health. And these areas include mental health, physical activity, sexual and reproductive health, and nutrition. The ARISE network has made a number of publications in renowned journals, facilitating collaboration and funding opportunities within and outside our borders, with the goal of improving health of adolescents and young people in sub-Saharan Africa. Some of the works of the ARISE network will be showcased today. Ladies and gentlemen, the main objective of this forum was to get an overview of the current policies and practice concerning adolescents' mental health and nutrition in Tanzania. We aim so by collaboratively leveraging on current evidence and best practices gathered from existing interventions for adolescent mental health and nutrition. Moreover, we are here to foster the sense of unity, collaboration, shared purpose among stakeholders who play a pivotal role in shaping the future of our youth. The well-being of adolescents is not just a matter of healthcare or mental health or nutrition. it is a reflection of our commitment to nurturing the generation that will lead into the future, a future that is very close. We are almost there in that future. And so there is no better time for us to invest on improving in lives and livelihoods of adolescents than now. As we all know, adolescents are at a critical juncture in their lives, and it is our collective responsibility to ensure that we have the support, we provide the guidance and resources they need for them to strive as they transition into adulthood. As we embark on this forum, let us approach it with a spirit of collaboration and an unwavering determination to contribute to making a lasting impact on adolescents in Tanzania. Together we have the power, we have the will to pave way for better and more resilient future for adolescents, for young people's generation in Tanzania, including all of us, young people. Even you, Professor Mwaikambo, na Mama Mrisho. I extend my deepest appreciation to our distinguished panelists that will be introduced later by Amani. We are honored to have with us Mr. Isaac Lema, President of the Mental Health Association of Tanzania. We are honored to have a young person representing, given some. It is also an honor to also have in the panel Dr. John George from UNICEF, but also my colleagues from the Africa Academy for Public Health, and of course our esteemed Dr. Grace Magembe. Your unwavering commitment to improving the lives of young people and ensuring that the mental and physical well-being is commendable for adolescents. I also express my heartfelt dedication and appreciation to my AAPH team. Where are you? They are the main reason we're here today. Thank you for all your dedication. Ladies and gentlemen, I would now like to welcome my sister, Dr. Grace Magembe, to take the podium and give us the keynote. Thank you very much, and I wish you all a productive next couple of close to 90 minutes of this panel. Karibu sana, Dr. Grace.
Good morning, everyone. In a very special way, let me give a second good morning to Professor Esther Mwaikambo and Dr. Fatma Mrisho. And I think these ones, they deserve a Swahili one, shikamoni. Yes, there's no way you can stand here without recognizing these very important ladies in the health sector, but very specifically in this profession as far as we women are concerned. They are the champions. They showed us the way, so we always have to recognize them wherever we meet them. So once again, let me start by thanking all of you, especially Africa Academy for Public Health, for inviting me in this very important forum, discussing about adolescent mental health and nutrition. And I must declare adolescent health has been one of my priorities, very close to my heart. Dr. Florence Tem knows. Yes, I'm getting old, but they're still here. Yes, and let me also start by assuring you that adolescent mental health and nutrition has been, and it is still, one of the priorities in this government, and especially the sixth government under the leadership of our excellent Dr. Samia Suluhu Hassan. And we all understand that adolescents, we used to have this, the way of addressing them, that they are the future generation. Actually, they are the present and the future generation, not just the future, but also the present generation. And recognizing that, that's why the agenda of adolescent mental health and nutrition has really been one of the core interventions within the government of Tanzania in totality, but also specifically the Ministry of Health. So talking of the Ministry of Health, there are a lot of interventions and programs that are addressing the specific needs of adolescent health, as well including nutrition. But as a government, understanding that adolescents, they come with different faces, yeah? There are those who are in school, there are those who are out of school, but collectively they're all adolescents. And that's why the government, we have a multi-sectoral approach in looking at adolescents' well-being issues. One of them is looking at their economic welfare, whereby for those who are coming from the President Office, regional administration and local government, you understand that we have a specific fund that is supporting them to empower them economically. The 10% fund that is out of the collection from the local governments. You know, they have their 4% that is specifically allocated for them to empower them economically. But again, we are very grateful for our President, Dr. Samia Suluhu Hassan. We all understand that as far as education is concerned, from early years all the way to the high level, you know, education is free. Yeah, so every child who's eligible to be in school has to be in school regardless of their socio-economic status. But again, our president has taken a very tough decision of bringing back to school adolescents who for some reasons, somewhere in their lifetime, could not complete their education cycle, could maybe due to pregnancy and all other reasons. They now have the opportunity to go back to school when they are ready to do that. So all this collectively, as I said, as a government, we are doing all this to make sure that we address the needs of adolescents from their different backgrounds, and we make sure that they're also part and parcel of the sustainable development that we are talking about. So according to the census report of the year 2022, adolescents, and I'm talking of the age of 10 to 19 years, they account for over 14 million, which is about 25% of the entire population. And they're still growing. So we are talking about a very significant proportion of this country. 25% is not a joke. Yeah. So we understand that adolescence is the time actually where we all shape what the future should look like when we grow up. And it is because of this group actually has been one of our priorities. But we also understand that this group faces a lot of challenges, okay, such as a triple burden of malnutrition. We are talking of both undernutrition and overnutrition, overweight, obesity, as well as anemia. Okay, this is a very special group. And also mental health issues, including loneliness, depression. You have heard of several incidences of suicidal attempts or, you know, suicidal events from young people or adolescents included in that group. But also the Tanzania Mainland Global School-Based Student Health Survey and the Tanzania Demographic Survey, they've also given us very important data in terms of how we can use the data in changing or shaping our policies and practice in terms of addressing their specific needs. So these all show that adolescents are in need of deliberate policies and health programs that address their unique challenges, and also the government has been committed in making sure that this is achieved. So far there has been some achievements that as a government, together with our partners, we've been able to achieve. One of them being in nutritional outcomes. We've been able to reduce stunting from 34.7% in 2014 to 31.8% in 2018. But also anemia among women of reproductive age has been decreased from 44.8% to 28.8% from the year 2015 to 2018. So these achievements could not be realized without a collaborative effort between the government, training institutions, research institutions, but also all other key players that really address adolescent issues and needs. However, despite all these successes that we're talking about, there's still a gap in addressing the drivers of mental health problems as well as nutritional deficiencies in this very important segment of the population. So in responding to all these challenges, In the year 2021, the government launched the Accelerated Action and Investment Agenda for Adolescent Health and Wellbeing, the NAIA. I'm sure all of you are very much aware of it, and in Tanzania. So the agenda has been developed to address challenges that face adolescent health and well-being, and the needs that need to be addressed in the near as far as also in the far future. And the agenda focuses on catalytic and accelerated actions and investments in this very important group in order to reverse what is potentially already or is soon to be a very unwelcoming situation as far as adolescents are concerned. The agenda is anchored on 6 pillars, one of them being prevention of HIV, preventing teenage pregnancy, preventing sexual, physical, and emotional abuse in adolescents, but also improving nutrition in adolescents, keeping boys and girls in school. As I said, when you want to address adolescent health issues, you cannot just focus on health. You really need to be very broad and take everything in a very comprehensive manner. And the last one being developing soft skills for meaningful economic opportunities. And these pillars represent all the priorities for interventions and investments in Tanzania that can ensure a productive population of these adolescents, ultimately achieving actually what the government is really looking at in terms of protecting but also promoting this very important segment of the population. So the government of Tanzania is overseeing the implementation of all these pillars through multi-sectoral approach, as I discussed before. So we have the Minister of Health, we have the Minister of Education, we have Pure Raj, but we also have the Minister of Community Development, Gender and the Elderly, and the coordination of the Prime Minister's Office, because this is where all the sectors are being coordinated. So we've realized that none of the sectors can do this on their own. Each sector has got their own interventions, very specific with that within their mandate. But again, we realize that we need to be coordinated somewhere, and this coordination is under the Prime Minister's Office. So I'm very pleased to see that this forum is in line with the pillars of NAIA, yeah, because I think that's why we are here. So in line with the theme of this forum, which says which is focusing on adolescent mental health and nutrition in Tanzania, evidence, policy, and practice, it remains equally important to share knowledge and evidence-based findings in forums such as this, which has gathered many key stakeholders of adolescent health. And I'm sure this will also guide the government, you know. When we are formulating our policies and practice, we need evidence. And this evidence is not only from the government, but it is from various stakeholders, including all of you who are here. And I'm looking forward actually to seeing us that with your support, with the evidence that you bring forth in this forum, we'll be able to design interventions that are sustainable and that are scalable to respond to the wide needs of adolescents, as I have already pointed out. So lastly, let me take this forum, or let me take this opportunity to call upon every one of us gathered here today to continue advancing efforts towards addressing the issues which will be mentioned throughout the presentations, and learn how best to improve our practices through scientific evidence-based approaches. With this, I thank you for listening, and I'm looking forward to very exciting presentations and sharing from all of you. And as far as I'm concerned, I just want to leave you with 3 takeaway messages. One is that adolescents have unique health and nutritional challenges. You cannot just group them like any other person. They are very unique, they are very different. So this should be key as we design our interventions. But the second message is a multi-sectoral approach to addressing adolescent health and nutritional needs is key. None of us, no one sector can do it better than the other, but rather we need collective efforts. And last, adolescents need deliberate policies and programs, programs that will address their unique health challenges, nutritional issues included. After having said that, I want to thank you once again, and thank you so much for inviting me. Looking forward to hearing a lot from you and also learning from you. You know, when you come from the government, you really need to listen more than talk. So that's exactly what I'm going to do in the next few minutes. Asanteni sana.
Asante sana, Dr. Grace. That is 20 years of experience speaking from the Deputy Permanent Secretary, who also serves in the boards of the THS, TASAF, and DUP. She has contributed significantly in research in areas of adolescent health, in areas of RMNCH, HIV, NCDs, and emergency preparedness. So another round of applause for the keynote speaker. So introducing to you next is Dr. Felix Bundala. He is a medical doctor and holds a master's in health policy and management, over 15 years of experience at the Ministry of Health, holding various positions really related to childcare and health programs, currently serving as an assistant director of the newborn child and adolescent health. He is extensively experienced in policy development and coordination, which is related to reproductive, maternal, child, and adolescent health sector. Ladies and gentlemen, Dr. Felix Bundala.
Okay, thank you so much for the nice presentation, for the nice welcoming, and I should also thank the organizers, but for the matter of the time, let me say the oral protocols observed, and I will go straight to the matter. After my boss, Deputy Permanent Secretary, talking, I was asking myself whether I have anything to add, but I came to realize I can position myself to another angle so that I talk on this issue of the adolescent. But as she mentioned very clearly, that if you're talking about the police perspectives, it's the way the government is putting as the top priority for the adolescent. You all realize that adolescent, apart from that, the government are putting different strategies, as you mentioned about the NAIA, but it has been one of the priorities due to the fact that we are talking of the majority of the people who are important not only today, but also tomorrow. So this is part of the slide which I should not repeat, but just to say, although these sessions about the mental and nutrition health, but you should also understand when you're addressing about the adolescent health, we're not going as a vertical thing. This will have to address in totality, not only looking of the mental and the nutrition, but also the issue of the teenage pregnancy prevention, HIV prevention, but also issue of the gender-based violence, issue of occupational health, plus the mental health and the nutrition. So, but when we basically look at these issues in a police angle, we not only focus the way or the reasons we formulated these policies, the way we developed these different packages or different strategies to implement the policies, but also the way we are implementing these policies to the majority of the people. So we might have the good strategies, good policies, good packages, and different guidelines, but how are we reaching this adolescent? That's the issue we should be looking at. When we're looking at the adolescent, and I know most of us here, we are the health people of whom we are trained looking at the sick who are coming in the health facilities. But the majority of adolescents, they're not sick. Most of them, they will need the services apart, not only for the curative, but the preventive part, the promotive part. And they're scattered everywhere. We should not waiting for the adolescent in our facilities. They're in schools, then the church, then the community, there's training institutions, they're everywhere. How are we reaching them there? That's the issue we should be now looking at. And when we're reaching them, how are we reaching them with the right and the correct informations, but also the integrated informations? I mentioned previously, if we just go to the adolescents, whether in schools or anywhere, we are only talking on one issue, the mental health and nutrition. We are leaving the others. We might be missing some of the issues. Even maybe those who are coming with suicidal ideas, displaced, and any other mental illnesses, they may be resulting from other complications, like maybe it might be the stress from the economic issues of their issue of chronic illnesses and other parameters. So in our ministries, what we are talking with our partners, we have started, and we know we have done a lot of things in this area, but we think they're not enough. We still need to collaborate more. We still need to sit together and see how we can reach the majority of our adolescents in different places. So even the plan, sometimes this month in October, we're going to call a stakeholders meeting dealing with adolescents, of discussing, looking what we have done, what we have achieved, but the challenges around this area as we all aim to reach the majority of adolescents in all places where they are available. So stay tuned. I know most of you are stakeholders in this adolescent, and so we hope we're going to have a very fruitful discussion in this area. So based on the matter of time, maybe I have to stop here, and thank you so much.
Thank you, Dr. Bundala. As the presentations proceed, please pay attention to the screen to your right. There you will see the slides being projected. Now I'd like to introduce Dr. Mashavu Yusuf. She is an epidemiologist and biostatistician, trained as a dentist, working at AAPH as a research and programs manager. Ladies and gentlemen, Dr. Masha Yusuf.
Ladies and gentlemen, good morning. As introduced, my name is Dr. Mashavu Yusuf, and I work with the Africa Academy for Public Health as a research and programs manager. And I have the honor to take you through today a few of our works so that they can help guide and enrich our discussions later. So a brief overview, we are AAPH, Africa Academy for Public Health, and we have a mission to advance public health priorities through innovative research, training, capacity building, and knowledge translation. We have a number of strategic goals to improve health systems through training, to promote health systems research, to leverage partnerships and collaborations, and most importantly, to facilitate translation of evidence into policy and practice. We have a number of focus areas, all the way from maternal child, adolescent health and nutrition, without forgetting mental health, reproductive maternal newborn child health, institutional strengthening, non-communicable diseases, as well as infectious diseases. As Dr. Mary rightfully mentioned, we're very proud to have co-founded together with the Harvard Chan School of Public Health, the Africa Research Implementation Science and Education Network, which currently comprises of 21 member institutions from 9 sub-Saharan African countries, all the way from Botswana to Tanzania and Uganda. So to jump right into the evidence, I'll be sharing with you a few projects that we have done and a few findings for the discussions. We have a project in Zanzibar, which we call Rutubisha Afya, and this project aims to implement and evaluate the school-based micronutrient supplementation and education interventions in order to promote adolescent health. This is a cluster randomized study which has 3 arms and has enrolled 42 schools in the island of Unguja. We have 14 schools that are receiving weekly iron folic acid supplements, 14 schools that are receiving daily multiple micronutrients, and 14 schools which are serving as controls. To share just a bit in line with this forum today, findings from our baseline survey, what we found with regards to nutrition was that 12.9% of our adolescents are either overweight or obese, and this is higher among females at 16.4%. With regards to mental health, we found that 5.7% of adolescents reported low mood, sadness, feeling down, depressed, or just could not be bothered at all. 9% reported feeling worried, anxious, panicking, or tense, and 1%, which is very alarming, had thoughts or plans about suicide or self-harm. So this had us thinking of the intersection between nutrition and mental health. Does depression lead to overweight through overeating and things like this? Or perhaps overweight leads to depression through body image and stigma among adolescents. We have another project which is harnessing longitudinal data and digital technologies to improve adolescent health in Tanzania. And this really is a school and community-based project currently ongoing in Tanga. And a few findings from this with regards to nutrition was that we found 8% of adolescents were underweight. However, concurrently at the other end of the spectrum, 8.8% were also overweight. 16.7% were stunted and 27% were anemic. And all of these were higher among out-of-school adolescents compared to those who were interviewed in schools. With regards to mental health situation, we found that 0.3% of adolescents in Tanga had reported attempting suicide within the past year prior to this survey. And even more disturbingly, we found 1.6% of these adolescents had ever attempted suicide in their lifetime. So ladies and gentlemen, I would like to stop here for now and welcome my colleague to introduce to you another project at AAPH. Thank you very much.
Ladies and gentlemen, good morning to all. I'm happy to introduce to you our mental health project known as Being Initiative. This is a project that is funded by Grand Challenges Canada, which is aimed to improve young people's well-being. In this project, AAPH is working very closely with Ghana through the University of Ghana, and as Elia shared, this is part of the RISE network. The main aim of this project is really to conduct a desk research to gather and understand the context of mental health among young people in Tanzania, and also to conduct stakeholders consultation to fill in and identify the gaps, to build and strengthen the network in order to drive the mental health agenda forward. A few findings from our desk research: mental health issues is still very important in Tanzania, as highlighted by Dr. Grace earlier. The predominant mental health issues include depression, anxiety, and substance use. However, still there are gaps in capacity of the mental health service providers, such as psychiatrists and psychologists. From the analysis of our desk research, key drivers that were identified include personal drivers, and in these few groups that were found to be vulnerable, including orphans, young people in extreme living conditions, youth who are unemployed, all these end up driving young people towards mental health issues, as Elia said. Also past traumatic experience, as well as stressful events as young people transition from secondary schools to universities and the like. Furthermore, genetic factors were also found to be important through the stakeholder consultation, as some mental health conditions have a familial inheritance tendency. On the aspect of social drivers, bullying, which is really on the rise among students in school, was one of the drivers that was reported to contribute to mental health issues among young people. Also stigmatization, as we all understand, mental health issues is still a problem in our community. There is low perception on the mental health conditions. Most of the conditions are perceived to be bewitched and the like. So all these are affecting the service provision and improving mental health among young people. On the environmental drivers, we've all experienced the COVID-19 pandemic, the adjustment that people had to make during this time, including staying at home, limited number in terms of transport. So all these have found to be contributing to driving towards mental health issues among young people. Following the desk research, as I have said earlier, our next component was stakeholder engagement. We have been engaging with different stakeholders, including the government, academicians, international organizations, non-governmental organizations, as well as young people and people with lived experience. It is very important to gather and understand what they're actually going through, how best can we address their needs. And I'm very happy to see that our panel today consists of a number of key stakeholders, all that are important towards driving the mental health agenda forward. We had a total of 8 stakeholders engagement to date, and these were conducted through different approaches, including in-person meetings, virtual consultations, and online surveys. Furthermore, we engaged more than 30 young people as well as parents in order to gather their insight on what they're actually experiencing. A few findings on our online survey include priorities that were reported by our key stakeholders. Among them include mental health programs for adolescents in workplace, school or college mental health programs, as well as capacity building to healthcare providers in order to address these mental health needs. Our upcoming activities include a consensus building exercise in which key stakeholders will be invited, sit together, discuss and brainstorm what are the key areas and agree in order to drive the mental health agenda forward. We are planning to conduct our first stakeholder engagement workshop on the 12th to 13th this month, and this will be conducted during the first Tanzania Psychiatric Conference in Arusha. Following the consensus building exercise, after we have agreed on the priority areas, the research priorities, how to engage and invest with young people, we'll conduct a theory of change workshop in which we'll sit down and pinpoint the necessary steps that need to be taken in order to advance this agenda forward. And lastly, our exercise will involve a national dissemination plan, and this will be conducted for the government as well as all key stakeholders in the country, not leaving behind young people who are the key stakeholders in this exercise. Lastly, I'd like to thank our supporting partners that include Being Mental Health Initiative, the Arise Network, as well as Muhimbili University of Health and Harvard Tate Chan School of Public Health. Thank you very much.
Thank you, Dr. Innocent Yusuf. That is our Research and Programs Officer, trained medical doctor who holds a Master's of Science in Health Services Outcome Research. Now I'd like to introduce to you a service provider, a clinical psychologist at the Department of Psychiatry and Mental Health from MOHAS. Without further ado, let us welcome the chairperson of the Mental Health Association of Tanzania, Mr. Isaac Lema.
Good morning once again. All protocols observed, and I'm glad to be here, and thank you AAPH for organizing this. And one question as a chairperson of Mental Health Association of Tanzania is to ask your neighbor, when was your last time to go for mental health checkup? So that means the laughter has some sort of information on it. And it's just to remind you, mental health is important as physical health. When we kind of experience headache, we go for checkup. But also we have psychological and mental health kind of wounds that we need to attend to. So allow me to take you through the adolescent's mental health. So today we are focusing on adolescent who is really living in the changing world. We are talking about the changing world for the adolescents, and we really need to focus on that. And I won't repeat that, but just to highlight that there is a significant number in our population when we talk about adolescents who is 10 to 19. But we all know the adolescence is a stage, and it is very important time for laying foundation of good health. And this is it. And we know that they are equipped with energy, psychological and physical energy, but also they're equipped with creativity, and also they know what is good and what is wrong, or what is right and what is wrong. And in that case, then we really need to invest instead of just let them go away and not noticing them. So we know also many risks are happening at this stage, and they are vulnerable. And if they are vulnerable with all that, the energy that they have, sometimes if they go to the wrong side or to the side that they to the risk side, then you find them the investment will go on the bad outcome. But yet, we know that when we talk about mental health, the mental health condition usually starts during the adolescent at the age of 14, and this is excluded the disorders for the children. But globally, we know that it is estimated that 1 in 7 of adolescents aged 10 to 19, they experience mental health condition. So we really need to join our force and effort to make sure that we join the government in prioritizing the mental health agenda for adolescents. But also we have challenges when it comes to data. We really don't have enough data to address the adolescents' challenges that they are facing as far as the mental health is concerned. We know that when we talk about adolescents, we also talk at the individual level, and we know that they have vulnerability, but also they have protective side, which will help us on the prevention. And in that case, then we know peer relation can be a positive, or sometimes when used in a risk side, then it can be a risk for health. But also we have life experiences that are really making adolescents to be vulnerable. We have also positive relations within the others, but that can make it more protective of health challenges that the adolescents are facing. And if they have purpose in life, but also their self-esteem is positive, this will have to bring the protective side of individual adolescents. But at society level, we know that the violence are there. Previous, we used to say, when I was raised up, my parents told me, ukikua, utayaona. But nowadays we know that they are seeing a lot of things before even they've grown up. And in that case, then it is something that is happening to society, that they've been exposed a lot in the violence at family level, but also at society level, where we are chasing a thief, and then we are kind of providing harsh kind of treatment to the thief, but the adolescents, they are there and they are observing. But also bullying, it is happening at the schools, but also harsh parenting, it is there, where we are looking ahead, like they've been exposed to also some pictures or even kind of act that's happening at the society. But also we cannot run away from socioeconomic issues, including that are happening at the family level, but also substance use. Adolescents are exposed to the substance because sometimes the parents are just giving them to test, but also sometimes they are influenced by their peers. But at the end of the day, the accessibility, if they can be accessible, that means they are also be at the risk side. But also the experience and interaction with other members. At the environment, we know that we have excessive and problematic social media use, and no one has trained them on how to use. And we just expect them not to, but we did not invest them not to do so, or for them to understand and be in the position of protecting themselves. but also the poverty and food insecurity is an issue, and exposure to violence when it comes to the environment. So we know we have 3 pillars that can be helpful for adolescents: the family, health facility, and school, because majority of them, as Dr. Grace said, they are also in schools. So we need to do a really prevention at the family level, where we have to have parenting kind of interventions and also training to help the parents to understand how to take care of these young adults, because we want them now and also want them in the future. But also early identification of the symptoms of mental illness. When they are joining the school, they usually go for mental health checkup. They go for health checkup, but in many of the forms that they are available in schools, they don't even incorporate the mental aspect of mental health checkup, but also the issue of parenting support. But now we know that at the family level, at the health facility, usually the healthcare provider were the ones who went to the, they are supposed to go to the schools, but with the burden in the health facilities, so sometimes we don't go there often, and in that case then we need to integrate mental health services at the primary health care, because that's where adolescents are going when they are getting health challenges. But also availability of mental health outpatient and inpatient friend services for adolescents, and specialized, and we are grateful that now we have a specialized clinic for adolescents at Muimbili. But again, for school, we need to promote mental health and also to do prevention on that aspect and early recognition. So just to wind up, promotion, prevention, intervention is important, because if we don't do that, then we are there for treatment. And if we need to really to promote, we need to strengthen adolescents' capacity to regulate their thoughts and emotion, but also enhance alternative to risk-taking behavior, promote life skills resilience, and also promote supportive social environment. So thank you very much, and thank you.
Another round of applause, please. Now I'd like to introduce to you Mr. John George Ngariba, or Ngariba. He is a seasoned public health specialist. 20 years of experience, really, in programs management. He has worked in productive maternal and child health projects covering HIV, family planning, nutrition, and more. At UNICEF in Tanzania, he is the liaison and HIV specialist. He's directed impactful projects influencing policy and has driven successful HIV prevention campaigns. His strengths lie in, and you can write your questions on these, behavioral change, gender approaches, and policy advocacy. So ladies and gentlemen, Mr. John George.
Habari asubuhi. It's a great honor to be here this morning and to share some insights about our work, and specifically for adolescents on mental health and nutrition. I'll share with you some challenges along with that and some few recommendations. This information you have heard already, about 25% of our population is adolescents. We have 50-50 boys and girls, but in Zanzibar we have a little variation, as you can see. Regarding nutrition, in mainland, 13% of adolescent girls of 15 to 19 are overweight or obese. And about a little bit above the quarter of the same age group are anemic. The situation is even worse in Zanzibar, as you can see, and gladly we have Dr. Fatma Mrisho. I think you'll take the message. Of course, you know already, but then we are advocating for the information to be shared widely. We have discussed already through my previous, the previous speakers about the intersection between nutrition and mental health for adolescents. We understand, of course, overweight, and I've said about what we know for adolescent girls, that obesity can also relate with the mental health conditions. We have emotional problems, stigma related to, for example, obesity and even underweight severely, and low self-esteem. And of course, this can also be related to depression. We also know the risk of obesity to non-communicable diseases that can also contribute to mental health situations, especially on the self-image and the stigma. We understand also that, of course, previous speakers have spoken about this, like that during adolescence is the period where we can determine the lifelong dietary behavior of an individual. We also have some disparities for rural and urban. In rural, we have limited food options, and in urban, we have plenty of food. And of course, now we fail to choose the correct version or menu. Eventually, you see in rural area, the limited food option will result into some situation like depression, anxiety, poor academic performance, and this is a very important aspect to consider as well. Now we also know in most of our homes about the use of technology. We have issues to do with the abuse. Of course, Dr. Isaac has said about it, but also we have the issues to do with how adolescents can be bullied on the social media. The time they spend on social media, they're sitting on a couch or wherever they're sitting in activity, can also affect the way how they can look in relation to their nutritional behavior. So we have some opportunities on mental health and nutrition for adolescents. We have seen a growing recognition of mental health in the global health. Recently, you have seen and you have experienced about the pandemic, the COVID. Most of the funding that came also supported mental health and psychosocial support for adolescents and other groups. So those kind of opportunities, we have to use them to strengthen the mental health interventions in the country, use as an opportunity. We also know that mental health and the psychosocial support interventions are emphasized on HIV sector, especially for those living with HIV, particularly adolescents. So if we use the opportunity of these fundings, it can be a really good opportunity for us to strengthen interventions around this area. We have seen some investment in the past, and of course some are ongoing, including the PEPFAR support on HIV, that are supporting mental health and psychosocial support, the Global Fund for HIV, and the Global AIDS Strategy that emphasizes on mental health. So if the country will take an opportunity to emphasize and integrate interventions using these strategies and interventions available, funding available, it will be really beneficial for adolescents. The Ministry of Health and the Ministry of Community Development, they are working on different strategies. One is for mental health and one is for psychosocial support. So this is another opportunity that we need to make sure that they speak to each other, including the implementation phase. UNICEF is doing several interventions on mental health and nutrition. One of the examples is the work that we do, UNICEF and the UNFPA through the Canadian government funding. We are working with more than 1.7 million adolescents in the country, of course in selected geography, including Zanzibar. Some interventions that we do are including the mental health promotion and prevention And this is the work that we do with the Ministry of Health through the peer education program. We have a package that the Ministry of Health developed with the collaborative support from partners, including UNICEF. We have content on nutrition and mental health. The peer education, and we've seen the impact of peer support on intervention for adolescents. So this is a very good opportunity we see that we could scale up the government and other partners so that we can get to reach more adolescents. In Zanzibar, we have some interventions on school health and nutrition program, and we are really happy to see that they have some content on nutrition diety and intersection between personal hygiene and nutritional practices. So I'm sure we still have more time. So for the mental health and psychosocial support, we have some interventions with the ministry, with the government, specifically on developing chatbot for mental health for children and adolescents. And of course, we have an opportunity to include nutrition. And we have trained mental health coordinators and social welfare officers on mental health and psychosocial support. These are some of the priorities, including the diet, services, practice, and the capacity building to the national level and LGA level. Moving straight to the challenges and barriers, accessing mental health is a challenge. Dr. Isaac mentioned about the, if any one of us has done the mental status evaluation, Dr. Mgomela is laughing. Yeah, so normally we don't put priority on mental health, but it's a silent condition that no one can see physically. Sometimes we see the consequences. We have challenges on nutritional counseling, and this is why we have some regions like Mbeya and even Iringa where you have plenty of food, but then you still have stunting and malnutrition issues. We have stigma and bullying that's happening and it's not really well addressed. We have some cultural issues, and of course here we have expectations that you should be Miss Mbantu or you should be English figure. So adolescents are confused. And then now where is the, where should they be? Eventually this could be some effect with the self-image and how they may look like. I mean, like, eventually it will affect them in the way how they emotionally think. We have media stereotype. Of course, this is connected to cultural and also fragmentation on mental health alone and the psychosocial support interventions alone. So if we could have an opportunity of these two ministries to work together and partners also to combine the two, it would be really great. I've said some of the recommendations already, but we need to do integration of all these. Mental health, adolescent sexual reproductive health services and interventions all together, and nutrition, they should not be treated separately. Otherwise, we don't really have enough time for the same person to deal with many, many things at the same time. And then we have a multi-sector approach. The Deputy Permanent Secretary mentioned about this. And then we have school as a platform. Most of adolescents are in school. So if we need to reach adolescents of 10 to 19, we have to have strong intervention at school level. Now this means that we need to strengthen the school health program in the mainland particularly, and also to make sure that we review the school health policy guidelines, which are outdated. I think they're more than 10 years not updated. We also need to domesticate some of the WHO recommendations on mental health and integration with adolescent sexual reproductive health and nutrition as well. I would like to thank you for listening. Asante sana.
Thank you, Mr. Ngariba. Without further ado, we are actually short of time. I'd like to introduce to you to Ms. Given Sam. She Karibu, you can come along. She's a public health officer interning at the Ministry of Health. She's also working with the Mirembe National Mental Health Hospital in coordination and health promotion. So ladies and gentlemen, here's the voice of the youth. Karibu.
Thank you so much. Given Sam as introduced, and today as a youth representative, I'm very much honored to be part of this discussion on mental health and nutrition, which is a very important challenge in our setting. And since it affects everyone, regardless of their age or background. And so, but we have a good news, that the youth in Tanzania are taking initiative to leverage mental health by coming up with innovative solutions. So this is a proof that young people can take the lead and bring real change. So the real question that we have is, how can these young people lead and solve mental health and nutrition challenges in Tanzania with new and creative solutions? So to start, we have youth are advocates of change or agents of change. When we speak of agents of change, we are speaking of the young people's energy, enthusiasm, and willingness to challenge the existing norms that are not understood by our community. And when we speak of these, through the energy that youth have, it's possible for youth to drive awareness, but also advocate for change and also come up with innovative solutions in mental health and nutrition. Next, we speak of policy advocacy. Speaking of policy advocacy, we have policies in this context that are not well known in the whole aspect of mental health and nutrition. Policies like the National Adolescent Development Strategy of 2018, but also the School Health and Nutrition Policy of 2009. All of these policies need the voices of youth to be advocated well so that they can leverage the change we want to see in mental health and nutrition. Next, ladies and gentlemen, we have peer support networks. There are several peer support networks such as Mental Tanzania, but also Open Up Tanzania and Therapy Jam movements. These are minor movements that are led by youth to drive the change we want to see in adolescents, mental health, and also nutrition. And these platforms or peer support networks provide a safe space where young people or anyone can open up about their concerns, they can seek advice, but also obtain emotional support. Next, we have innovations driven by research. Ladies and gentlemen, young people in Tanzania are taking part of research programs, and through research, they are conducting research to create technology-driven mental health and nutrition tools. We have initiatives such as Rudy series by Afyatun, we have Heya Arp, and we have Rafiki Space. So let's see across these youth-led innovations that are taking leverage in Tanzania in mental health. Beginning with Rudy series, which is an educational and entertaining tool, which is a 3D animation series raising awareness on mental health. And this series not only raises awareness on mental health, but also it conveys complex health information to the community that it's really hard to be delivered from a health professional to a normal layman in the community. And diseases such as schizophrenia have been explained very well and in simple terms that any layman can understand through lived experiences in the community. Next, we have Heya App. Heya App is an artificial intelligence smart messaging app which uses cognitive behavioral therapy principles to empower young people. It encourages daily check-ins, of which it deals with negative thoughts and behaviors in order to promote positive mood, but also self-awareness. Heya App was launched in Tanzania by January 2023, and since its launch, it has shown positive improvements to its users by improving their mood, but also their general self-awareness. Last but not least, ladies and gentlemen, we have Rafiki Space. Rafiki Space is a a chatbot, which is driven by artificial intelligence, to help individuals with challenging emotions, but also experiencing loneliness. And Rafiki is trained to offer support with compassion and understanding by providing a space that is free of judgment, but also makes a room for individuals to open up through text-based conversations. Having said this, these are a few of the mental health and nutrition tools that are taking leverage in mental health and nutrition in Tanzania. But we ask ourselves, how do we ensure the sustainability of these innovations? How do we ensure that the remaining mental health gaps in Tanzania are filled by leveraging mental health innovations? And this is where we need sustainable youth engagement. And when we talk of sustainable youth engagement, we are speaking of youth-centered approaches. We are seeing that young people are taking part in driving change. And one of the things that has made me to see this, yesterday as the Minister of Health was speaking, I realized that if young people find themselves very concerned about the challenges existing in our country, it means they are the front line. They are making a real change to see the change that they want to see. So when we talk of youth-centered approach, we have to engage youth in decision-making and also programs that are youth-centered and can engage them to make that change we need to see. But also we need to leverage digital platforms for engagements. We are all witnesses that if we call for public physical gatherings that engage adolescents to come get trainings on how to maintain their mental health, we get really few of them. And as Dr. Grace mentioned, that we have a lot of adolescents in schools, but some of them are out of school. And one of the places where we can get these adolescents is in schools. And what about those who are out of schools? Most of the youth or adolescents are on their phones. So we need to come up with interventions such as mobile apps, websites, and social media campaigns that can reach these youth so that they can be motivated, but also encouraged to promote their mental health. The third point, we need youth-led research and advocacy. First, as we heard from, Mr. Lema, he mentioned of the research gap that we have. We don't have enough data in the field of mental health and research. Now, how do we fill this gap? And also, we have very little representation of young people in research. How do we ensure that young people are taking part in research? So we need to train young people. We need to ensure that these young people are taking part in researches, surveys, collecting data, but also participating in creating initiatives that are of help to themselves as youth, but also to adolescents. Last but not least is to invest in capacity building programs. As I've stated, the innovations that are existing, how do we ensure the sustainability as we are speaking? We need to incapacitate these young people. We need to make sure these innovations do not just give change today or just do not get funds for today. We need to ensure that they go beyond what is seen to the vulnerable areas, to the rural areas, and so youth need to be incapacitated in advocacy, counseling, but also program management. To sum up, so young people are really taking part in driving change in mental health through innovative solutions. But how do we take part in that movement of young people? We need to support them. We need to embrace innovation and take part in creating a greater future for mental health in Tanzania. Thank you so much.
We need to go beyond. That's the message. So we've seen innovation. We've seen a call for interventions in schools. We've also seen a call for more engagement at health facilities. Now let me open up the floor for questions. Now the fastest to raise their hands will get the questions because of time. Okay, I'll give 5 questions first, and then we'll see if time allows. So I'll give numbers. I won't call out names because I might not get them right. So number 1, if I have eye contact with you, that means I've chosen you. Number 1, number 2, number 3, number 4, number 5 in the back. Someone please help us with the microphones. We have a few up front here. Number 1, please raise your hand. And number 2, please raise your hand. Panelists, please feel free to write down the questions, and then we'll answer them at a go. Karibu.
Thank you. My name is Elizabeth from MDH. My question goes to, I think, the last given, Sam. Thank you so much for the presentation to all panelists. Regarding social media use, I know some of the apps that you shared were geared towards the older adolescents. Looking at our current situation, we have much younger ages engaging in phone use, and we've heard from the other panelists about the detriments of using social media at a younger age unsupervised. I'm wondering if you're thinking of creating some sort of safety guidelines to support our current adolescents who are really, you cannot stop them from engaging in social media and at a very young age. So guidelines that will help us to at least have some sort of guidance on how to approach social media for children, and these can help parents as well as teachers, integrating them in the education system.
Number 2. Please give the mic to number 3.
Thank you. At least side of it, because in most cases,
please go directly to the question.
It's
kindly.
Adolescents don't like ugly things. So whenever we talk about negative issues, adolescents lose interest. So let us talk about the positive. For example, we have 14% of adolescents with mental problems, but we have 86% adolescents with good health. So let us talk about the positive issues for adolescents because they are attracted to that. And second one is on an issue related to mental strategic plan. The Ministry of Health at the moment, we are developing a mental strategic plan. So Mr. and Mrs. Sando, please come in to contribute on our strategic plan because soon we are going to launch it. The third one is with our colleague given Sam, Dr. Gracie Chonamwibaga kwa ajili ya kutupa issues. And with that, so we talked with Obongo kids, asking them to develop characters for children because you can't train children just by being wise. You just create a role model that they can follow. So Obongo kids as well, we are approaching them to incorporate some of the adolescent and main characters because in Tanzania at the moment, we don't have the characters that children follow.
Number 3, please raise your hand. Number 4 also, please raise your hand. I gave numbers, all right.
Thank you for the good presentation. My problem is definition of health, nutrition, and stunting. And stunting is 30% after year 2. And once you are stunted, you are mentally dwarfed or stunted over your entire lifespan. Am I correct? Yeah? So 0 to 6 million children are stunted. 5 to 9, we have another 6 million stunted. Adolescents, we are talking about 4 million stunted. So 30% of the population of 60 million, 30% are stunted. That means 20 million people.
Please ask your question.
So my question is this. When we are, what is the definition? Because we are talking physical stunting goes along with mental stunting over entire lifespan. So why are we singling out adolescents for interventions when it is across lifespan? Thank you.
Number 4. Number 4 is right here. Number 4 is right here. Number 5 also, please raise your hand.
Hello. Thank you so much, and I want to congratulate AAPH and the panelists. This is a very pertinent topic, and I'll just focus on the mental health aspect. And Florence Temo, Country Director from AMREF, and this is what we call as social determinants of health. We, much as we can be at health issues, I think social deviance is what we see, mental health challenge that we're talking about, and reflection of our social status. It's a whole society, and apart from the digital platform, I think we can also remember the, what do you call the diamonds? The Zuchus. I mean, the influencers, basically.
Please go to your question.
So my point is, we need to also sensitize our influencers in the communities when we talk about mental health challenging to our adolescents. It does not just happen like that. It's the entire society influence apart from the digital platform. And my plea, strategies, and my request is that before we put up another strategy or guideline, that intervention gets down to the community level. So far, mental health is regarded as a facility-based problem. It's a hospital issue. But community intervention, household level, daily talk. You ask who did his or examination before. That should be almost a daily issue. In the morning, not the same person in the evening. Things change, but how do you manage our emotional intelligence, etc.? So I think we need to see how to make health workers and our community structures.
Thank you so much. Number 5. Please, someone help me give the mic to number 5. Panelists, please prepare to answer these questions very briefly. We shall start with the DPS. We shall go to Given. We'll come to Mr. Lema, and then we'll come to Mr. Bundala, and then we'll come to Dr. Bundala, Dr. George, and then we'll end up with Dr. Mary, who will also give us the closing remarks. Number 5, Karibu.
Thank you, moderator, and thank you to the panelists for good presentations. My question goes to the last presenter, and I was very impressed with the applications. I wanted to know if they are already available in the Play Store or App Store. And as a parent, how can I go about to access them so that I can better guide my adolescents? Thank you.
Thank you so much. Let's begin with Deputy Permanent Secretary, Dr. Grace Carey. You can just have a mic.
Yeah, thank you. I think the rest will be responded by my colleagues, but let me start by saying that I'll go directly to the issue of stunting. I think that's what will really need my response. The rest, my colleagues will do that. We are discussing adolescents and nutritional needs because in the context of this discussion. But that does not mean that we do not have interventions that are addressing the mostly affected groups. And I'll just share with you a few initiatives that are ongoing in the country in collaboration with our various partners. We've all heard about the compact. Yeah, this is an MOU that the president of this country has entered with all the regional commissioners in terms of making sure that they implement key interventions that are of priority. They are interventions that we agreed as a nation, as a country, that these ones should be given a priority in terms of implementation. And they are being tracked from the community level all the way to the national level. And every year, every regional commissioner has to report what was the target, what have they achieved, what did they not achieve and why. And this is a multi-sectoral strategy. So, and it is really looking at that particular age you're talking about, because we all know that before you see this adolescent at this level, they have to start somewhere. And all these are focusing towards that particular area. And the other thing that I really want to talk about that addresses what you're talking about, we all understand nutrition has been a key issue in this country. For instance, we have a number of programs that address reproductive, maternal, newborn, and child health. Talk of micronutrient supplementation to children, but to women of reproductive age, and also adolescents. All these are being done to address that particular area of stunting. You'll agree with me that when you're talking about stunting, the areas that are mostly affected, they are the food basket regions. You're talking of the Southern Highlands region. So right now, as I'm speaking, there's an ongoing survey looking at what are the factors contributing to that, because those are the food basket regions. That's where food is. So is it an issue of behavior or what exactly it is? But we all understand. I know my neighbor here is also coming from that place. We have women really who are hardworking there. What they're looking at is doing business, you know, going to the farms and stuff like that. And looking after children, probably that comes second. So we are also looking at that, you know, the behavioral change issue on how do we communicate this message, how we can support these women to continue with whatever they are doing, but also take their role of taking care of the children.
Yes, thank you.
But let me finish by saying that when it comes to stunting, that's why we have this ongoing survey. Because if you look at stunting, and the parameters that we are looking at, I think I'm also stunted. If you look at my age, in my height, probably I'm also stunted. So where did we get these, where did these parameters come from? Are they relevant to our context? Did we borrow them from somewhere where they are more relevant than our country? This is what the scientists will tell us in the next survey.
Thank you, Dr. Grace. Given. In 1 minute, please.
Thank you. So it happened, she asked and she answered at the same time about safety guidelines. Of course, there are safety guidelines for all the apps that I've mentioned, especially with Heya app and Rafiki Space. And I believe almost all of us use ChatGPT for most of our activities, and that's where Rafiki Space derives its information. So it's integrated, and it's a safe tool, but also Heya app, it's also very safe because since, as I said, since it's leveraged, most of the people have been feeling secure using the app and without the information being leaked or used anyway other than their concerns. Thank you.
Thank you so much, Mr. Lema.
Thank you very much. I think most were comments. I'll take them in. But just to wind up to say, let us continue as positive to invest on adolescents' energy because they have it, creativity and their ability, using available resources such as time that we spend with them, the quality time, but also the skills, the knowledge that we have as adults, but also we support them so that we can have a future generation with a good mental health. Thank you.
Dr. Gundala?
Okay, thank you so much. I'll go number one. I think safety guidelines. But, maybe we should not think about only having the guideline, but think how are we reaching the communities and telling the communities in the household the way they should be doing at home to make sure that the use of these different medias, they are used in a safe manner. How often have we come out in the TV, the radios, and talk these messages? This is something we should be discussing, and that is what basically we are planning to be talking in our stakeholders meetings. Number two, the term we have made, you made it very clear that we should think not only about developing new guidelines or reviewing the new guidelines, but making the scale, the coverage of the available guidelines. I have said we met in March. Some of you who participated, we discussed and we realized The only participants were coming from the Ministry of Health and some of non-government organizations. Then we decided that we are going to call another stakeholders meeting, which will also involve the organizations specifically dealing with the adolescents, but the adolescents themselves, discuss and see whether the approach intervention we are doing is the one which is being needed by them, and see the way we should be going forward to make sure that the majority are being reached. Thank you so much.
Thank you, Dr. Mr. John. Just briefly.
Yeah, thank you so much, everyone. So for me, I just want to emphasize about the integration of the work that we do for adolescents. No fragmentation. So this is what I think we need to do, including the development partners who are providing funding to support the CSO and also the government itself, including the ministries that are working for mental health and also the psychosocial support with the Ministry of Community Development. Thank you so much.
Thank you so much, Mr. John and the panelists. Before I welcome Dr. Mary for her response and closing remarks, I'd like to apologize to the people with very many burning questions, but also call on you to carry on the conversation in the corridors and beyond this conference. We shall also be at the Mental Health Conference in Arusha, so come with your questions. We shall carry on the conversations. So, Dr. Mary, without further ado, please, your responses, and kindly give us the closing remarks. Asanteni-san.
Hi, everybody, again. In the interest of time, I will not go through what I prepared as few remarks to appreciate all of you for your time. Thank you for giving us your time to be here, and I would like to really appreciate the presence of my teacher, Professor Sylvia Kaya, in the room, whom many of us today we are speaking mental health, but it is because of mentors and trainers like Professor Sylvia Kaya who have really championed and continue to do so in advancing mental health for our country. My brother, Dr. Likindikoki, thank you so much for also being here because you continue championing the work. But we also have a very special person, Auntie Sadaka, if you may also stand. Auntie Sadaka Gandhi, that we all know from a lot of social media engagement, is a champion of youth health, parenting, psychological counseling, and all. We really appreciate the work that you're doing, and please continue to do so. The initiative that Dr. Innocent mentioned, she is very much part of that, and we look forward to your continued support to ensure that we really, as Given mentioned, understand from the adolescents themselves what do they think can really work, because they are leaving the adolescence age at the moment. Kwa hiyo, without any further ado, I would like to really again say asanteni sana sana for your time, and we don't want to take any extra minute. I know we were given 10 minutes extra because of the little earlier delay. I think we are on time now, right? Asanteni sana, and I wish you all a wonderful day. Thank you very much for our esteemed panelists. Jamani, makofi mengi sana for our esteemed panelists. Dr. Grace Magembe, Dr. Felix Bundala, Mr. Given Sam, endeleni na makofi. John George, and Given Sam. Asanteni sana, thank you.
Hello.